Hello, and thank you for meeting with us today. My name is Nicole, and I'm a nurse manager here at DRHA for the radiology department. I'm here with the business plan development team, and we're here to talk to you about our proposal to merge our two outpatient imaging centers. Currently, we have two outpatient imaging centers that are both losing money. One of the centers houses our MRI and CT machines, is in a building owned by DRHA a couple blocks away from the main campus, and has a vacant second floor. The other building does DEXA scans and mammography and is in a leased building a couple miles away from the main campus. We have had complaints from patients that it is in an inconvenient location. Staffing turnover is also an issue at 25% for both buildings. We want to use this as an opportunity to improve patient and staff satisfaction while decreasing total overhead costs. Because the lease on the breast imaging building is up in 90 days, we have everything planned out so that we won't need to lease the building for another year. We understand that the implementation plan is an important aspect of success, and according to Karatko in his book, Entrepreneurship, Theory, Process, and Practice, published in 2014, a couple of the reasons new ventures fail are poor timing and product design problems. For that reason, we're not going to rush the merger if everything is not ready, so we've made an agreement with the landlords for an optional extra 2 months lease as a safety net if needed. We want to tackle issues related to patient and staff satisfaction, so in the first month, we will start out with surveying patients and staff for their perceived issues and difficulties. Staff buy-in for the merger will also be important, and we plan on notifying staff as soon as possible, especially since the merger will mean decreasing the total number of staff. Options will be given for staff to find other positions within the organization. We will also use a select group of staff and patients to assess the new space and work with a contractor in order to make an efficient and satisfying space. According to an article by Heron, Hamida, and Taleb in 2012 from Procedia Social and Behavioral Sciences, patient satisfaction may be related to their expectations and perceptions, making spatial design a potentially important aspect of patient care. In the second month, the new staffing model for the combined imaging centers will be finalized by DRHE leadership, and specific staff members will be transferred to the new center. Plans for the new space renovation will be finalized and construction started. We will also use the second month to start some team-building exercises to secure staff buy-in, create a better team environment, and increase staff satisfaction. Palazzo in Nursing Administration Quarterly in 2015 stated that merging middle management and laying off one manager may make some staff members feel as though the remaining manager has bias for their original staff. There is a possibility of feelings of betrayal and dissatisfaction, so it will be important to get staff buy-in to make them feel invested in this merge, as staff participation is imperative to the successful implementation of this venture. We will also begin orientation to the new building for the staff members from the breast imaging department. In the third and final month, renovations should be complete and we can start to move the breast imaging machinery to the new location. We will do this as soon as possible in order to give enough time for proper setup and calibration. DRHA can lease imaging machinery for this month in order to facilitate continuity of patient care. The remaining office furniture and supplies will be moved at the end of the month, and patient services should be able to begin immediately.
Thank you, Nicole. My name is Denny, and I'm the Chief Financial Officer for the DRHA. As Nicole stated, in an effort to increase revenue and patient satisfaction while decreasing expenses, we're presenting a plan to combine the two DRHA outpatient imaging facilities into one more fiscally sound and ultimately profitable clinic. First and foremost, we will be eliminating the cost of leasing the breast imaging center by housing all outpatient imaging in the building presently owned by the DRHA. Secondly, we will be reducing the number of outpatient imaging staff members from 20 between the two existing facilities to 15 at the proposed new combined facility. The goal in the first year of operation will be to maintain the average of 80 patients per week, which is the current estimated number of patients seen at the two facilities combined. The breakdown of projected revenue for the first year of operation in the proposed new imaging center is as follows. In a 2011 article in Radiology Today, MyRisk states that an average cost of an imaging exam ranges from $320 to $3,200. This puts the mean cost at $1,760. With our 80 predicted patients per week at the center, assuming each patient receives an average of 1 to 3 exams per the historical average between the two existing centers, the average number of images performed and billed for each week will be 160. After assessing the reimbursement percentages of Medicare, self-pay, and private pay patients, and the percent of each of these patients we typically receive at the current imaging centers, the annual revenue created at the proposed new imaging center would equal approximately $3,611,328. While monthly revenue would be adjusted based on seasonal volume changes, the average monthly revenue for the new facility would be approximately $300,944. Moving on to projected expenses in the first year of operation, According to a 2012 article written by Kavanaugh, Siamati, Abusalim, and Cody in the Journal of Nursing Scholarship, staffing should account for 50 to 70% of operational expenses. The new imaging center will accommodate 15 FTEs broken down as follows. 1 RN manager with an annual salary of $80,000, 2 radiology physicians with an annual salary of $270,000 each, 2 radiology nurses with an hourly wage of $33.85 each and an annual wage of $68,640, 6 medical imaging technicians each with an hourly wage of $22 and an annual wage of $45,760, and lastly 4 front office staff members each with an hourly wage of $15 and annual wage of $31,200. This puts the annual amount spent on salaries and wages at approximately $1,156,640. In a 2008 article in ImageBiz Online, Smith states that employee benefits should cost approximately 30% of employee wages and salaries. By this measure, the employee benefits package offered to the imaging center staff will cost an estimated $346,992 annually. The supplies for the new imaging center will fall into such categories as medications, general medical supplies, environmental service supplies, and office supplies, and will cost an average of $1,900 monthly with an annual expense of $22,800. This dollar amount includes the rental of a temporary mammography machine to get us through the transition at a one-time approximate cost of $1,125. Medical professional services such as housekeeping, medical waste disposal, and linen will cost the center approximately $3,000 monthly with an annual expense of $36,000. Non-medical professional services, in which category we will place marketing, insurance, maintenance contracts, property tax, utilities, and tech support, will create an annual expense of $95,900. There will be several capital expenses in the first year of operation to include the lease on a new DEXA scan machine, making the new imaging center more marketable and costing $25,800 for the year. The remaining capital expense purchase will be a one-time moving company fee of $3,500 and a new picture archiving and communication system, or PACS, being the greatest expense at $440,583. In a 2006 article in the Journal of Digital Imaging, Reddy, Lowe, and Kane identify PACS as a system which will allow images to be transmitted electronically, greatly reducing the amount of funds required for the production and storage of imaging films. In summary, the first year of operation of the proposed new DRHA Imaging Center, after subtracting the estimated operating and capital expenses from the estimated operating revenue, will produce a total estimated realized revenue of approximately $1,465,893.
Thank you, Denny, for that fantastic overview of the budget plan. Good morning. I'm Bethany, the Director of Outpatient Radiology. The benefits of this business plan are twofold: the enhancement of quality care for patients in this community and the improvement of DRHA's financial condition. Patients are DRHA's priority. As Diffenderfer, Denon, Taylor, Snyder, and Malcolm recommend in 2015, this team has exercised a thorough investigation of the desires and expectations of both centers' patients and has tailored this business plan to suit their needs. The outcome of this merger is to create a hub for radiology treatment and education. For patients, this means improved access and convenience and a smoother flow from the time of the exam to the time the patient gets the results from the radiologist. The second outcome of this venture is better financial stewardship as well as increased revenue. Although DRHA is a not-for-profit entity, as Schultz in 2015 points out, it must have some profit in order to continue business. While I won't repeat what my colleague Denny has just presented, I will highlight 2 points. First, this business plan eliminates several unnecessary and duplicate costs, as Marquette, Denham Taylor, and Pinzuk mentioned in 2015. These are the building lease and staffing and overhead costs. Second, as you just heard, the plan outlines financial profit and potential for growth. As Donald Karatko states in his 2014 book, Entrepreneurship, Theory, Process, Practice, a good business plan must assume and prepare for growth in the company. This merger places DRHA in a better financial position for growth. Dr. Karatko also emphasizes the importance of having insight into how a business venture will meet expected goals. The plan for this merger supports and furthers the mission, vision, values, and strategic plan of DRHA, which you are already familiar with. The mission is to be a leader in patient care, education, research, and innovation. In this plan, streamlining of patient care, promotion of education via a central location, and the provision for new state-of-the-art DEXA technology moves DRHA towards that mission. This merger supports the vision to be a community guiding force for health and well-being by designing a hub of radiology information, education, helpers, and experts to guide patients through their medical journey. It also supports DRHA's values by putting the patient's desires at the core of the plan and seeking to improve the workplace for DRHA employees. Finally, this budget outline plays into all 5 elements of DRHA's strategic plan. As was just discussed, the budget supports, number 1, financial sustainability in the department as well as throughout DRHA. The foundation for this merger is evidence for its reliance on, number 2, research and innovation. Number 3, quality patient care is the primary focus of this plan. The Radiology Center will be a promoter of, number 4, lifelong learning through educational opportunities. And finally, the marketing campaign for the new center will, number 5, support health and wellness as outreach activities in the community surrounding DRHA.
Thank you, Bethany. Good afternoon, and again, thank you for taking the time to be here with us. My name is Katie, and I'm the Director of Marketing for the Outpatient Imaging Center. Our marketing program for the merger will focus on attracting new clients and retaining current patients. With the rollout of the Affordable Care Act, we are seeing a spike in patients with new health insurance looking for preventative care and screenings. These patients vary in age, but the majority age from 25 to 55 years old. We want to capitalize on this age range and use electronic marketing through avenues such as Facebook, Twitter, TV commercials, and electronic brochure. I'm going to pull up the brochure for you now. The first page, seen here, announces the new center, provides information about the location of the center, and services offered. The second page explains how the merger will focus on patient-centered care and patient satisfaction. The other column provides information of services offered, including our new DEXA scan machine. And the last page asks patients and families to visit our Facebook page, follow us on Twitter, and gives the address and phone number for contact information. The marketing department will set up a Twitter account that will tweet about the progress of the merger, construction updates, as well as general information about the center. Our Facebook page will post pictures of the staff and of the center. We also ask patients to share their positive experiences about the center, as well as ask questions regarding the new center. The electronic brochure will be emailed to all current patients that have an email address registered with the DRHA. A hard copy of the brochure will be a trifold brochure and distributed to every house within a 5-mile radius of the facility. A hard copy of the brochure will be displayed in the lobby of the main hospital building, all outpatient offices where patients are seen, and will be included in the discharge packet of all patients discharged from the DRHA hospital. We framed this presentation on 2 main points. First, we knew that you needed to be impressed with the cost savings and resource synergies resulting from this merger. Second, we knew you needed to be convinced that the service delivery would maintain its current exceptional standard and improve upon it. We believe in today's presentation we have showed you why both of these things will be true. Thank you for reviewing this proposal, and we look forward to completing this successful transaction.